for any questions you may have.
Thank you, Madam Chair. Thank you, Madam Ranking Member. Dr. Scavello, we share a deep concern about how several of the bills on today's agenda have the potential to severely undermine the VA's ability to provide care to veterans. VHA has other missions beyond being a direct provider of care, right?
Correct.
How will diminishing resources for VHA's direct care system in favor of privatization of veterans' health care affect VHA's other three missions, research, training, and emergency response?
Yeah, so thank you for that question. So we do have 4 missions within VA. The first is obviously to provide health care. The second is related to our training mission for healthcare professions trainees, which includes our physicians, our nurses, and our other allied health professionals. We also have a research commitment, as well as supporting the United States in times of public health emergencies such as COVID. So what we're seeing is, as a result of not having the number of cases, the complexity of cases within our building, is that we're unable to retain, also recruit the staff that's required to work in those areas. That has a trickle-down effect to our ability to conduct research, our ability to continue to partner with medical schools and nursing schools to bring students in, which thereby will continue to further reduce the talent that we have available within VA, and unfortunately, also in this country, because 70% of physicians do come through some type of VA experience during their either medical school or residency training. So we know that there's a trickle-down effect. So that is concerning to us.
Yeah, and that was actually going to be my follow-up, is how, could you speak a little bit more to how that can impact then the overall healthcare system?
Yes.
Yeah.
So with those training opportunities, again, through all of those different professionals, including clinical pharmacists, we're concerned that without having the rigor of the cases, that's going to potentially affect the ability to provide that training and education to the country's healthcare professionals. There was a saying when I was a resident, I used to take call between every 2 to 4 nights, overnight, in-house. And the common statement by our attending physicians when I was a resident was that if you are off every other day, you miss 50% of the cases. If we don't have the cases coming in our doors, then our residents and our trainees are missing those cases and can't build their skills, can't build the momentum to advance.
Thank you very much, and I'll yield back my time.
Thank you very much, Representative Budzinski. The chair now recognizes Representative Radewagen for 5 minutes for any questions she may have.
Okay. Talofa, Madam Chairwoman. My question is for Ms. Peabody. Your written testimony states that VA opposes codifying access standards for community care. Why do you think unelected bureaucrats, rather than elected officials, should determine when veterans should have choice in their health care decisions?
Thank you for that question, Congresswoman. We're focused on providing veterans access to world-class care that they deserve, where they need it and when they need it. And healthcare is an ever-changing landscape. And so we think it's very important that the department has the flexibility to be able to adapt with changes to the industry. We're not comfortable with the overly prescriptive proposal in the legislation. We feel that codifying it would inhibit our ability to make sure that we can best serve our veterans. And we're happy to discuss opportunities for improving the legislation.
Ms. Peabody, is telehealth being pushed by VA to reduce veterans' community care eligibility?
I'll take that question. So telehealth is not used as a modality to stop the care that's provided in any modality. Between a clinician and a patient, there's discussion about the appropriate type of care that should take place. If telehealth is a viable and safe and high-quality solution, then we'll recommend that. But we also look at telehealth opportunities in the community as well as within our organization. And what we don't want to do is deny somebody a face-to-face visit in the community if the same care can be completed via telehealth internally and vice versa. So again, it's the veteran's choice what they're comfortable with, and it also depends on the clinical situation we're treating. If the situation is amenable to telehealth and that's the most accessible form of healthcare, we will provide that and offer that as an option.
Thank you, Madam Chairwoman. Yield back.
Thank you very much, Representative Radewagen. The chair now